Good morning, good afternoon, good evening to everyone watching me here now. And in this live, we're going to talk about 12 weird signs, 12 signs that you're not used to that can indicate damage to your liver, that can indicate a diseased liver. And it is very important to know these signs so that you have the necessary information and also learn how to avoid the problem from getting worse. Because with the right help, your liver has a great ability to regenerate. And many people mistakenly think that only excessive alcohol consumption is capable of causing liver damage. But that's completely wrong. In fact, excess sugar, excess ultra-processed foods, excessive consumption of vegetable oils rich in omega-3, frequent use of painkillers such as acetaminophen and ibuprofen, and some viral infections can also be responsible for major damage to your liver. So if you want to learn how to protect your liver, this very important and indispensable organ, for the proper functioning of your body, I recommend that you stay with me until the end of this live, because I will also show you simple home remedies that are extremely useful to detoxify your liver and prevent further damage. But what are the signs and symptoms of liver problems? Before we start, I ask you to let me know. You can write in the chat and also write in the live comments from which part of Brazil or the world you are watching me now. I'm from Rio de Janeiro, however. At this moment, I'm in Foz do Iguaçu, Paraná. I even went to Ciudad del Este, Paraguay earlier to do some shopping. And where are you? Are you in Brazil? Are you in Portugal? Are you in Argentina? Are you in Mexico? Are you in Africa? Where are you? Write in the comments, write in the chat, and also let me know if you have any liver problems, because I want to get to know you better. So let's get started, because our 12th strange sign of liver trouble is a change in the color of your stool. And then there's a change to a lighter stool color, because our liver sends bile acids to help in the digestion of fats, giving the stool the usual brown color it has, that brown of normal stools. However, if you have a liver problem like fatty liver or some other liver issue, bile flow may be impaired, resulting in lighter colored stools. In certain cases, part of the stool may even float in the toilet water, indicating the presence of undigested fats that are floating, which we call steatorrhea. The 11th sign of liver problems is having trouble seeing at night. So if your night vision or your vision in poorly lit places isn't the same as it was before, this could be a sign of vitamin A deficiency. And why? What does vitamin A have to do with the liver? Bile is crucial for absorbing vitamin A, a fat-soluble vitamin just like vitamins D, E, and K. Vitamin A is essential for cells in your eyes that help you adjust to different light levels. If your liver isn't functioning well, you may not absorb vitamin A properly, leading to night blindness. This can also indicate a gallbladder issue, especially if you have dry, irritated eyes. Our 10th symptom, or rather sign, is swelling in the right foot. When blood flow in the liver is inadequate, it can cause the liver itself to swell and enlarge. This enlargement increases pressure in a vein called the portal vein, leading to fluid buildup in the feet and legs. Legs causing the swelling that we technically call edema. How will we know that someone has edema? First, it's by looking, then you'll see that the foot or ankle or leg is swollen. Another way is by touching, right? Performing digital pressure, pushing on the area where it's swollen, and when you remove your finger, your fingertips impression will remain. The area where you were pressing will be marked. We call this the goad sign. The 9th symptom is also a sign because, right, a symptom is anything that we feel, and a sign is what we see or measure. So pain is a symptom, nausea is a symptom, but now swelling is a sign, a skin spot is a sign, hair loss is a sign, fever is a sign, high blood pressure is a sign. So I'm just doing this little review with you guys. Our ninth sign is chantelasma, which is those people who here near the eyelid have as if it were a little piece of skin, a piece of flesh of a more yellow color. There are yellow plaques on the eyelids, and it's caused by the buildup of cholesterol in the skin. And this buildup of cholesterol in the skin is possibly a result of the liver's inability to metabolize the cholesterol. Our eighth symptom, but first, I ask that you leave your like, because when you like it, you make this content reach another person. So when you like it, you'll make another person also know what the signs are that indicate the liver is sick. So you giving a like has the potential to help a person avoid, for example, cirrhosis. Imagine if your like prevents cirrhosis in a person and a person you don't even know. So the power of your like is immense. What is a like? It's a thumbs up, Dr. Joao. It's a thumbs up. So click on the thumbs up, click like to make this video, this content reach a person, and that person will watch this video. And once watching this video, they'll know how to protect their liver from the big ones. Threats, and by the way, we can't live without a liver. So much so that when the liver stops working, what happens? Liver transplant. There's nothing that can replace the liver. It's not even like the kidney, that the kidney stops working. At least you still have hemodialysis. In the liver, there's no liver hemodialysis. There's no hemodialysis related to the liver. There's no such thing. So we need to have a healthy liver to have a healthy life and to live too, okay? So our eighth symptom is pressure on the right side of the abdomen. It's a pain or discomfort just below the ribs on the right side, which is exactly where our liver is. And this pain and discomfort is usually more frequent after eating because a diseased liver can cause the bile to become more viscous, facilitating the blockade of the channels that connect the liver to the gallbladder, thus causing pain, pressure, and discomfort on the right side. This pressure can even affect the phrenic nerve, generating tension and pain. Muscle in the right shoulder. So pain in the right shoulder can also be an indicator of liver problems. Our seventh sign is red and purple spots, because when your liver is congested, inflamed, fibrous, impaired, it ends up producing less clotting factors, which is one of the main functions of our liver, besides detoxifying our blood, besides metabolizing toxic substances, besides synthesizing albumin, a protein essential for our health. The liver also synthesizes, also participates in the creation of clotting factors. And if we don't have clotting factors, we bleed more easily. And then any little tap we give our skin will cause bleeding and will generate a red spot or a purple spot. So they are bruises more easily because of the absence of clotting factors. The sixth sign is cracked heels, because your body depends on vitamin B3, niacin, to keep the skin healthy and prevent it from becoming cracked and dry. And when a person has a liver disease, some disease in the liver, the body ends up directing vitamin B3 to try to repair the liver tissue damage. And then there is less niacin, less vitamin B3 left for other parts of the body, for other functions. So without a sufficient amount of vitamin B3, the soles of your feet and your heels can become dry and cracked. Our fifth symptom is intense itching, which is nothing more than a very strong itch, mainly on the palms of your hands and the soles of your feet. This happens because a diseased liver does not metabolize bile acids correctly, and then these bile acids, these bile salts, end up accumulating in the skin. And this accumulation of bile salts in the skin also generates an accumulation of histamine in the bloodstream, which ultimately ends up generating itching, generating pruritus. So it's very common for a patient with more advanced liver disease to have uncontrollable itching. In the same way, in some cases, patients who have a gallbladder problem, a gallbladder that is not functioning very well, may also present these signs and symptoms. Our fourth sign is white nails or clubbing. Unfortunately, I don't have the picture of digital clubbing here, but what is it? It is what we call watch glass nails. That person who has a chubby finger at the tip with a nail that curves like a watch glass. This happens in individuals with liver diseases. So those extremely whitish nails or fingers with clubbing, watch glass-like nails are also pointers to liver diseases, but they could also indicate other issues. They suggest a deficiency of oxygen in that area. Our third symptom is dark urine, because the liver is crucial in breaking down old red blood cells, our aged red blood cells, or our blood cells that have been circulating for about 3 to 4 months and are due to be eliminated. Now, these red blood cells contain a substance named bilirubin. Resultantly, when the liver or gallbladder doesn't function properly, bilirubin can build up in the body and get expelled through the urine. Thereby, in the urine, it makes the urine color become very dark, resembling a tea or even a cola soft drink, because the liver isn't performing its function of metabolizing bilirubin. Our second sign is yellowish skin, which we technically call jaundice, and that is one of the most common signs of liver disease, especially in more advanced liver disease. And this jaundice affects the skin, the sclera, which is the white of our eyes. It affects this lower part of our tongue, the frenum of the tongue, and this yellowing is also due to the accumulation of bilirubin in the body. So the accumulation of bilirubin bile salts can turn the urine dark and can also cause jaundice. And then that bilirubin is produced when hemoglobin breaks down into indirect bilirubin. Once this indirect bilirubin is bound to albumin, a protein also synthesized by the liver, it is transported to the liver, once again taken up by hepatocytes, which are the liver cells, and then it ends up becoming direct bilirubin, which is a water-soluble bilirubin. And that direct bilirubin is excreted by the bile in the adeno, which is a part of our gut, our small intestine. But if there's a liver problem, this bilirubin can end up accumulating and generating jaundice. Guys, the last symptom, in fact, the last sign, is vascular spiders, which we call telangiectasias, which are small dilated blood vessels on the surface of the skin. And the causes for these blood vessels, for these telangiectasias, are a few. So there are some hypotheses behind the appearance of this clinical manifestation. One of them is portal hypertension. The pressure in the portal system increases because of the resistance to blood flow in the liver. And that generates greater pressure in the veins called mesenteric veins, which causes dilation in these veins and greater pressure in the collateral vessels, in the vessels that are nearby, including the small vessels. And that increase in pressure causes these vessels to dilate and form telangiectasias. In addition, liver disease can generate changes in vascular structure and can also cause dysregulation of angiogenesis, favoring the formation of new vessels. And another hypothesis is that people with liver disease end up having higher levels of estrogen, thus favoring the appearance of these vascular spiders, which can also appear in the mucous membranes, such as the gastrointestinal tract mucous membranes. So look, if you have any of these signs and symptoms, talk to your doctor to investigate what's going on. So it is essential that if you are going through this, you do a test, you do a hepatogram to check how your liver enzymes are, to see how your canalicular enzymes are, how your direct and indirect bilirubin are, and also the ultrasound can be interesting to assess if there is any structural damage to your liver or if there is an accumulation of fat in it. But okay, I told you here, what are the signs and symptoms that indicate liver disease? But how can we reverse liver problems? How can we reverse a diseased liver? Generally, liver diseases begin with the accumulation of fat, which is steatosis, and then this steatosis evolves into inflammation, which is hepatitis, and this inflammation will generate scarring in your liver that'll cause fibrosis. And then when your liver is fibrosed, all healed but scarred, a scar that causes the liver to lose its function, then we'll have the diagnosis of cirrhosis. But luckily, your liver has a great capacity for regeneration. It's that story we always tell here from Greek mythology about Prometheus bound. Prometheus stole fire from the gods and gave it to mortals, and the gods were upset with Prometheus, imprisoned him, chained him, and put a curse on him that every day a bird would peck at him and eat a piece of his liver, and that liver would regenerate and the next day the bird would be back to eat another piece of his liver, but his liver would regenerate every day. It shows that even back then in ancient Greece, they knew about the liver's ability to regenerate. So if you follow the tips I'm about to give you, the chance of your liver recovering is huge, especially if you don't have cirrhosis, especially if you have mild hepatic steatosis with a small amount of liver fat. So if you do what I'm going to tell you here now, your problem will improve, okay? So the first thing you have to do is reduce your intake of refined carbohydrates. So you have to avoid sugar, you have to avoid white flour. So if you have liver fat, you can't drink soda, you can't eat sweets, you can't keep eating a lot of white bread. So these foods need to be avoided as much as possible. Second, introduce foods rich in a substance called sulforaphane. And what foods are these? Garlic, broccoli, kale, spinach, cabbage. Sulforaphane increases levels of glutathione, which aids in liver detoxification. Third step to help your liver regenerate is to drink coffee without sugar with a hint of turmeric and a hint of black pepper, because the polyphenols, the phytonutrients, the piperine, the curcumin in this shot, in this mixture that I've just told you, they are going to help repair the scars caused by fibrosis in your liver. And our fourth point here, our fourth and last point, is to drink lots of water so that it keeps your blood properly flowing. This will help the liver to produce more bile, to get rid of the fat deposits that are inside it. And if you want to mix this water with lemon juice, even better, because the lemon will also help you with this goal. Just don't put sugar, okay? Otherwise, everything will be wasted. Guys, these are the tips, okay? You must have seen here that if you want to fight fat in the liver, if you want to prevent your liver from being harmed, from the problem of your liver evolving in a negative way, you need to change your habit, you need to change your lifestyle. So you have to eat better. You have to maintain a healthy weight, because if your liver is accumulating fat, it's because your body as a whole is accumulating fat. So from the moment you engage in physical activity, that you improve your diet, that you stop being sedentary, that you maintain a healthy weight, in the same way that you will lose fat in your whole body, you will also lose fat in your liver. So don't think it's going to be, oh, I'm going to eat a garlic a day, I'm going to eat a portion of kale, a portion of spinach, and I don't need to change anything else. This will solve the problem. That's not going to solve your problem, okay? You need to make a complete change in your lifestyle. If you want to know how to do this without doctors, tests, medications, or expensive supplements, you know what you're going to do? Click right now on the first link in the description or the link pinned in the comments, and you're going to get your longevity code and a book of my own. I'm sure that when you start putting the guidelines in the book into practice, you'll have a better life with more energy and willingness. And you'll also be taking the first step to eliminate, to burn all the fat from your liver. So click now on the first link in the description or the link pinned in the comments. Start reading, and you can also start the countdown for your life to transform for the better, okay? Let's go to our chat here.